Ever feel tired, irritable, or anxious for no clear reason? For many older adults, these symptoms can be a sign of a hidden mineral deficiency, magnesium. Today, we're going to reveal 9 hidden magnesium deficiency symptoms that many people miss. Your body stores most magnesium in your bones and inside your cells, while only a small percentage circulates in your blood. The biggest mistake people make when checking magnesium levels is relying solely on this blood measurement. It's like trying to understand the story of a whole book by only reading the first page. You'd miss most of what's really happening. That's exactly what happens when people look at blood levels for magnesium or other nutrients. They're only seeing a tiny part of the picture. Let's first take a look at what can quietly reduce your magnesium levels. Hundreds of medications can lower magnesium levels over time. Other factors include stress, too much sugar, caffeine or alcohol, and high insulin caused by eating too many carbs, which can make it harder for your body to absorb magnesium. Low hydrochloric acid in the stomach, which is more common in older adults. Low salt intake and not enough vitamin D can also quietly reduce magnesium stores in your body. In the United States, studies show that many people don't get enough magnesium, making awareness important. Now let's go through the hidden magnesium deficiency symptoms. Quick disclaimer. This video is for educational purposes only and isn't a substitute for medical advice. Let's get started. Symptom number 1. Muscle cramps and twitches. Ever notice your eyelid twitching for no reason or wake up with a sudden leg cramp at night? These little annoyances may not be just aging. They can sometimes point to low magnesium. Magnesium acts like the relaxation switch for your muscles, while calcium acts like the contracting switch. When magnesium is low, muscles stay tighter than they should, causing twitches, cramps, or spasms. Magnesium also helps prevent calcium from building up where it shouldn't, like in your heart cells, joints, or arteries. Getting enough magnesium helps your muscles relax properly and keeps your body moving smoothly. Symptom number 2. Always tired, no energy. If you feel tired all day, even after sleeping enough, or you wake up already exhausted, this can be a sign of low magnesium. It's not just normal tiredness. It feels like your energy is constantly low, no matter what you do. You might notice you get tired easily, struggle to stay focused, or feel like your body just doesn't have the energy to keep up with your day. It can feel like you're running on empty, even when you haven't done much. Magnesium is needed to produce ATP, which is your body's main energy source, and this happens inside the mitochondria. Without enough magnesium, your cells can't make or use energy properly. Symptom number 3. Trouble sleeping. If you fall asleep fine but suddenly wake up around 2 or 3 a.m., wide awake, staring at the ceiling, this can be a sign of low magnesium. You might feel like your brain is wired or notice your heart racing for no clear reason. This often happens because of a cortisol spike during the night, which can push your body into a stress state at the wrong time and disrupt deep sleep. Magnesium plays a role in calming the nervous system, so when it's low, the brain may struggle to fully relax during the night. Millions of adults in the U.S. report sleep disturbances, making magnesium awareness important. Symptom number 4. Heart palpitations. If your heart suddenly starts racing, fluttering, or feels like it skips a beat for no clear reason, this can be a sign of low magnesium. You might notice it more after caffeine, stress, or even when you're trying to rest. It can feel uncomfortable or even scary, like your heart is beating too hard or out of rhythm, even when you're not doing anything intense. Magnesium helps control the electrical signals of your heart and keeps calcium and potassium balanced. When magnesium is low, your heart can become more sensitive, and your body may stay in a fight or flight state, making these palpitations more likely. However, it's important to remember that heart palpitations can be caused by other underlying conditions. Please seek medical attention immediately to rule out more serious issues. Symptom number 5. Migraines and headaches. If you often get migraines or tension headaches, it could be a sign that your body needs more magnesium. Magnesium helps calm overactive nerves in your brain. When you don't have enough, these nerves can get overstimulated, which can trigger pain and headaches. Getting enough magnesium can help your nerves settle down, making headaches less frequent and less intense. Symptom number 6. Numbness or tingling. If you feel a pins and needles sensation, numbness, or tingling, especially in your hands, feet, or even around your face, this can be a sign of low magnesium. At first, it might come and go and feel mild, like when your arm or leg falls asleep. Sometimes it can feel like a slight burning or buzzing under the skin. In some cases, it may happen along with muscle twitches or cramps. Magnesium helps control the electrical signals in your nerves. When levels are low, nerves can become more sensitive and start sending signals when they shouldn't, which leads to these strange sensations. Symptom number 7, brain fog or confusion. Ever find yourself staring at the ceiling at work, struggling to remember simple things, or feeling like your brain just won't keep up? That cloudy mind feeling can be a sign of low magnesium. Magnesium helps your brain get energy and keeps your nerves from going into overdrive. When it's low, your thoughts slow down, your memory slips, and focusing on everyday tasks, like paying bills, remembering names, or following a conversation, can feel harder than usual. Some people even notice short moments of confusion or feeling a bit lost, especially when tired or stressed. Symptom number 8, nausea or upset stomach. Feeling nauseous or having an upset stomach can be an early sign of low magnesium. Magnesium helps the digestive system work smoothly, and when levels are low, the stomach and gut can get out of sync, which may cause queasiness or even vomiting. It often starts mild, like feeling queasy after meals or for no clear reason. Symptom number 9, high blood pressure. High blood pressure can sometimes be a sign that your body doesn't have enough magnesium. Magnesium helps your blood vessels relax and keeps important minerals like calcium and sodium in balance. Without enough magnesium, your blood vessels can tighten, forcing your heart to work harder and slowly raising your blood pressure. People might notice this especially if they already have a poor diet or other health conditions, but it can happen quietly without any obvious symptoms. If you're taking medication for high blood pressure, do not stop or change your dosage without consulting your doctor. Magnesium can help support your health, but it should never replace prescribed treatment. Now let's take a look at which magnesium forms you should take and which ones to avoid. Not all magnesium is created equal. Magnesium oxide is a common form, but it's not a good choice because your body doesn't absorb it very well. To get enough, you'd have to take a large dose, and that can sometimes cause diarrhea. A much better option is magnesium glycinate. With this type, you not only get magnesium, but also glycine, a protein that helps your brain's GABA system. This means it can help calm your nervous system, improve sleep, and support relaxation. Some people think magnesium glycinate can't affect the brain or sleep, but that's not the full story. Many of the processes that help you relax and sleep happen in your gut and tissues, not just in the brain. So how can you take magnesium to get the best results? Timing and method make a difference. The best time to take it is after your evening meal, when your body's winding down for the day. This helps your muscles and nervous system relax and can even support better sleep. You can take magnesium as pills or powder. Pills are simple. You just swallow them with a glass of water. If you prefer powder, measure the recommended amount, add it to a cup of water, and stir until it's completely dissolved. Warm water helps it dissolve faster, but cold water works too. You might just need to stir a little longer. Drink it right away so your body can absorb it efficiently. The United States National Institutes of Health notes that magnesium is absorbed best in smaller amounts. For many adults, the recommended upper limit for supplements is around 350 milligrams per day. Taking more than this at once usually isn't necessary, as the body may eliminate the excess. If you're unsure about the right dosage for you, check with your doctor. Now let's go over 3 practical tips that can make your magnesium supplement even more effective. First, be careful about what you take magnesium with. Some medications or supplements, like certain antibiotics, diuretics, or high doses of zinc, can reduce how much your body actually absorbs. This is especially important for seniors, who often take multiple prescription medications. It doesn't mean you shouldn't take magnesium, but spacing it out from these medicines can make a big difference. And if you're unsure which ones might interfere, it's always a good idea to check with your doctor. Second, watch what you eat or drink around the time you take magnesium, because some things can get in the way of absorption. Drinks like coffee, tea, and energy drinks, alcohol, and very high doses of calcium from milk, cheese, or yogurt can all interfere. Even certain carbs like white bread, pastries, or other highly processed starchy foods can reduce how well magnesium works. Taking it with lighter, easy-to-digest meals like vegetables, fruits, or a handful of nuts helps your body absorb it properly and feel the full benefits. Third, pair magnesium with vitamin D3 and vitamin K2 whenever possible. Magnesium helps activate vitamin D3, and vitamin K2 works alongside vitamin D3 to support bone and cardiovascular health. Taking all three together can help your body use these nutrients efficiently and support overall wellness. Now, before we wrap up, there's one important thing to keep in mind. The 9 symptoms we discussed aren't for self-diagnosis. Just noticing one or a few of them doesn't automatically mean you're magnesium deficient. There could be other causes. When you notice these signs, consider reviewing your diet, checking your magnesium intake, or consulting your doctor to rule out any underlying issues. If you found this video helpful, make sure to hit like and subscribe so you don't miss the next one.